imperative to follow a specific diet post-operatively to minimize any risk or complication. On the first day after surgery, you're going to be following a clear liquid diet. This includes water, herbal teas, and non-carbonated beverages. Try to avoid juice during this time because, as mentioned, foods that are high in sugar can cause weight regain in the future. Try to take small sips throughout the day for a total of 8 cups or 64 ounces per day. From day 2 through 14, you'll be on a full liquid diet. As we try to emphasize protein sources at this time, your best bet would be to choose protein shakes. Try to choose protein shakes that are less than 10 grams of sugar and high in protein. On the 5th day, you can try some Greek yogurt, nut butters such as peanut butter and almond butter, and blended soups. If it's a bean base, you'll be getting a little bit of fiber in there as well. It's important to follow up with your dietitian and surgeon before you progress to the 3rd phase of the diet, which would be a thin puree. Thin puree foods are those that roll off the back of a spoon and require very little chewing. Try foods again that are high in protein, such as cottage cheese, soft tofu, a mashed up veggie burger, a soft scrambled poached egg, pureed soups as mentioned above, and pureed bean dishes. As you progress to the next phase of the diet, on the 4th week, you can try foods that have a little bit more of a thicker consistency. It's important to emphasize how well you chew your food and to make sure that it's a paste before you swallow. Again, consider foods that are high in protein and that are moist, juicy, tender, and avoid anything dry or rubbery that may be difficult to chew. Foods include pureed dark meat, chicken or turkey, ground meats with a little bit of gravy to moisten it up, white flaky fish such as sole and salmon, tuna fish with light mayonnaise, and egg salad. On the 5th week, you'll be moving on to soft, solid foods. Again, emphasizing a total of 60 to 80 grams of protein a day from the food sources such as dark meat chicken, thin sliced deli meat, ground lean beef, chicken and turkey, canned chicken and tuna, white flaky fish, low-fat dairy products such as cottage cheese and Greek yogurt, a scrambled, poached or soft-boiled egg, tofu, soy products, veggie burgers, and beans. It's important to follow up with your dietitian for a variety of foods. Remember that after bariatric surgery, about 80% of your stomach has been removed, and you have a small reservoir that you want to fill with nutrient-filled sources. Focus on protein from whole foods and protein supplements. Here are some tips to keep you successful. Number 1, the rule of 30. Try to avoid eating and drinking at the same time. Your stomach will get full very quickly with small amounts of food, and if you drink fluids on top of it, it can cause a lot of pressure. Try to wait 30 minutes between eating and drinking. Number 2, eat your food very slow and chew your food very well. It's important to pause in between each bite, swallow, allow the food to settle in the pouch, and then take the next bite. Remember, the stomach is very small and can fill up very quickly. Number 3, ensure that you eat your protein first, your vegetables second, and starch last. We want to make sure that you're aiming for your 60 to 80 grams of protein per day. So be sure to make sure each meal starts off with a protein source. Number 4, avoid empty calories that have no nutritional value. Foods such as potato chips, pasta, bread, crackers, and chips can lead to weight regain with time. Number 5, avoid anything fried, high in fat. These can cause stomach pain as your body is cleansing itself, so there may be some side effects. Number 6, the feeling of fullness is going to be very different. You're not going to feel it down in your belly anymore, but may feel it up by the chest. Pay attention to your satiety signals by eating slow and chewing well. If you feel that pressure, slow it down. Number 7, make sure you read those food labels. As you've learned, sugars should be less than 10 grams per serving and fiber greater than 3 grams per serving. Number 8, ensure that you are well hydrated. Try to strive for 8 cups or 64 ounces of water or any sugar-free beverage per day. Number 9, exercise. As mentioned, to preserve lean muscle mass from breaking down, it's important to participate in strength training activity when cleared by your surgeon. And lastly, always make sure that you're taking your vitamins and minerals as directed. It's important to follow up with your healthcare provider to see if you had any preliminary deficiencies, and make sure you're taking adequate chewable vitamins within the first 4 weeks of surgery, and then you can move on to solid pills.